so much. So you know I served 21 years in the Army, retired as a Warrant Officer 4, and I was close to using my military voice, but I figured since I have the governor here and the former governor, maybe I'd postpone the military stuff. So welcome, welcome, welcome. So good morning, and on behalf of our President and CEO of the WellStar Health System, Candace Saunders, thank you for joining us this morning. Welcome to the future home of the WellStar Columbia County Hospital and Medical Office Building affiliated with the Medical College of Georgia. My name is Dr. Ralph Turner, and I am proud to stand before you and tell you I am the first president of WellStar MCG Health. Thank you so much. Thank you. It's wonderful to see so many people here to celebrate a milestone, not just for WellStar Health System, but for the people of Columbia County, the largest county in the state without an inpatient facility, and for the Central Savannah River area. We are honored to welcome Governor Brian Kemp and his First Lady, Marty Kemp. Thank you so much. Chancellor Sonny Perdue. President Brooks Kiel, Chairman Doug Duncan, Mayor Garnett Johnson. Where are you? Thank you, sir. Thank you for coming. County Manager Scott Johnson. I know you in the room. I should be there. Thank you, sir. And many other Columbia County officials, welcome to today's event. From WellStar, we have a couple of board members, Ms. Mitzi Moore. Thank you, ma'am, for joining us. And Greg Morgan. Thank you, sir, for joining us. We also have from the WellStar MCG Health Advisory Board, Dr. Mercer. Where are you, Dr. Mercer? Thank you, and Dr. Ron. My two closest advisors. Thank you guys so much for joining us. And we have many other executives from our WellStar Health leadership. Please stand up, be recognized. I just got to ask you to stand up. Please do, please. Thank you so much. Thank you. Thank you all. Thank you. We are grateful that each one of you has joined us for this event today. At WellStar, our mission is to enhance the health and well-being of every person we serve. We look forward to continuing to work with you and ensure the patients and communities we serve have the best care possible. To our President and CEO, Candace Saunders, we thank you for your leadership and your vision that led you to pursue this merger with AU Health and form WellStar MCG Health. We also thank you for your tenacity and grit to stay the course through many years and see the merger through to completion. A merger that will not only improve the health care for the Central Savannah River area, but for all Georgians. Personally, I would like to thank you for giving me the opportunity to serve as the first president of WellStar MCG Health permanently. Thank you. Thank you. Thank you. I'd also like to thank my wife, Ann, sitting right next to former Governor Perdue, our Chancellor. Over the past several months, the windshield time for my truck then went up fourfold. She's been right there with me, altering her work schedule to be with me when she could. So she's given a new meaning to the term ride or die partner. And thank you. Thank you. You know, 2 weeks ago, the ceremonial groundbreaking that you're sitting in today didn't exist. It was all clay and wasn't smooth. We didn't have the road. When we received the call from WellStar corporate headquarters and asked could we do this 1 April, we were planning for May. We thought it was an April Fool's joke. Especially when we said we had to prepare for Governor Kemp and our Chancellor, Sonny Perdue. We just knew it was April Fool's joke. But here we are, 1 April, no joke, 2 women went to work tirelessly. 2 MCG health leaders went to work tirelessly over the last 2 weeks to get this done. Jennifer Miller, our Vice President of Strategy and Operations, and my Operations Manager, Catherine Pollard. Y'all please stand up. Thank you so much. Thank you so much for making this a wonderful event today. God well done, ladies. God well done. So, you know, when our Executive Vice President of Acute Care Operations, Mary Chapman, my boss, called me and offered me this job permanently, I was way excited. I was excited. You can tell I said permanently twice, right? I was excited. So I had to share the news, right? So I shared it with my wife, wasn't satisfied. My mom passed away in July, so after I shared it with her in prayer, still wasn't satisfied. So I called my aunt and uncle, shared the news with them, and they were like, so? You know, it was like, okay. But when I shared with them that I had to go to a speaking engagement with the governor of Georgia, Governor Kemp, and our former governor, Sonny Perdue, you should have heard the commotion on the other end of the phone. It was, you thought I was going to the White House. When that commotion finally settled down, my aunt spoke to me and she said, positively impact as many lives as you can. She said, do good or don't do it all. So with them, it's all about the company you keep. Immediately, my aunt realized that I was keeping company with difference makers. When I spoke of Governor Kemp and I spoke of former Governor Sonny Perdue, she realized I was keeping company with difference makers. That's what the leaders at WellStar have challenged our team members to be. That's our rallying cry. Be difference makers. And I thank you for the opportunity. I'm honored to be here today and honored to serve as the WellStar market leader, responsible for bringing this innovative facility, which is massive, forward to providing high quality, accessible care in the region. It will be a full service acute care hospital, more than 250,000 square feet, 100 acuity adaptable inpatient care beds, an emergency department planned to be a level 2 trauma center, surgical platform to include operating rooms, cath labs, interventional radiology, and endoscopy rooms. Imaging labs will also be in the hospital. We will have a medical office building of more than 90,000 square feet, which includes primary care, women's health, and other specialties, for a patient-focused medical office building for all of Columbia County residents and neighboring communities. As medical practitioners, we understand that someone's ability to access health care directly impacts their well-being. But there's so much more to it. It's how we deliver care. Patient and family advisors participated in the design of the hospital. The design encompasses generational planning for our community. It will become a health and wellness destination that serves the needs of multiple generations. The hospital encompasses what we're all about at WellStar: compassionate, world-class care for the whole person. That's what we call people care. By offering a wide range of services, WellStar Columbia County Medical Center will deliver on our commitment to health care for every family member at every stage of life. So I look across this site and I see people who have gathered with us today, and I'm very grateful. I'm grateful for the leaders who are making this facility a reality. It takes vision, dedication, and a tenacious can-do attitude, just like our president and CEO. I'm grateful for how this hospital and medical office building will increase access to care for the people of this community and the surrounding areas. I'm grateful for the jobs that will be created for the region, those including those for students attending Augusta University and the Medical College of Georgia. You know, it takes a team of teams to accomplish a project of this magnitude. So I want to thank a few of those teams. Thank you to the team of the Columbia County Management. Thank you to the team of the Board of Commissioners. Thank you to the team of the Columbia County Hospital Development Authority. Thank you to our design team, the Smith Group. Thank you to our construction team, Turner Construction. Thank you to our team of program managers from Higdon and Herring. Thank you to Governor Kemp, Chancellor Perdue, President Keel, and many other public officials and civic leaders who have assisted us to get to this point. Thank you so much. Please. Thank you all for being here today to acknowledge this milestone as we move forward. Now I would like to introduce our Columbia County Chairman, Doug Duncan. Thank you.
Good morning. Just making sure. Well, I want to give you a little history lesson on our permanent Columbia County Hospital. The exploratory committee was founded or put together in 2012 to determine the feasibility of a hospital in Columbia County. The RFP for the hospital went out in 2013. The CON was approved in November of 2024. Of course, there was a legal challenge or two that we had to work through, but of course, here we are today. So the most important thing to me is to acknowledge folks that have played a big role in that, and frankly, we wouldn't be here today. First, I want to thank the Columbia County Commissioners from all those years ago, because without their vision, without that study, we wouldn't be here. I invited Chairman Ron Cross, but he couldn't make it, but I know former Commissioner Trey Allen. Trey, you here? Trey, I just want to thank you. Without what you guys did, Trey also serves as the chairman of our hospital authority, so he's been involved in issuing the bonds for this project. Secondly, I want to recognize Chris Driver, the county attorney, and Scott Johnson. I don't know if you realize, but the process we went through to get the contract signed for this whole project was onerous, and I believe it took almost 18 months. And I lost track of the iterations back and forth to button down all the little gory details. But at this point, you can see it was very successful. So again, I don't know if Chris is even here. Maybe I forgot to invite him. But he did all the work, and I'm just very, very thankful. Don't tell Chris. Lastly, I just want to thank the Wellstar team. Your investment in this market, not only in Columbia County, but the greater Augusta region, is going to have impacts for years and years. It's going to raise the bar on healthcare. It's also going to give a different place or an additional place to train medical students. And so this has just a much bigger grasp, a much bigger benefit for than just Columbia County, but for the whole Augusta region. So that we're very, very thankful. So. And now I'm going to ask President Brooks Keel to come up and give a few remarks.
Well, good morning. What a beautiful day it is to come together. Thank you, Chairman Duncan. This has been a long time in coming. And that's probably the understatement of the year, if not the decade. There have been so many individuals responsible for making this possible, as you've already heard. and there just isn't enough time to thank them all, but there are a few that I would like to point out. First and foremost, I want to thank Governor Brian Kemp and First Lady Marty Kemp for being here today. Governor, you have always appreciated the importance of the other Georgia. We all know what I mean by that. And your support for the Augusta community and for Augusta University has never wavered. We know we would not be here today without you, and we're extremely grateful for your continued leadership and your support. Second, I want to thank Chancellor Perdue and indeed the entire University System of Georgia staff, most especially Teresa McCartney, for your tireless efforts towards making this project a reality. Chancellor, we know you have 25 other universities and colleges to worry about, although they're not anywhere near as important as this one. We can't thank you enough for your leadership and dedication towards negotiating the extraordinary partnership between Augusta University, MCG, and Wellstar, and for making this day possible as well. I want to thank my staff, especially Dr. David Hess, the Dean of the Medical College of Georgia, and Yvonne Turner and Dr. Russell King for their hard work in the efforts towards making this event possible. And I want to acknowledge the former members of the AU Health System Board of Directors, ably chaired by Regent Jim Hull, for their dedication to this university and our health system and to this project. Regent Hull, we especially appreciate the great work you've done. Thank you so much. I know there have been numerous others who have spent countless hours over the past decade, more than a decade, in designing and implementing this project. We're especially grateful to Drs. Philip Cool and Charlie Howell, and to Madeline Wills and Jennifer Miller, who you've already heard, and so many others for your past and continuing work on this undertaking. To the citizens of Columbia County, we say thank you for your patience. And to the administration of the county, especially Chairman Doug Duncan, County Administrator Scott Johnson, and now State Representative Gary Richardson. Gary, congratulations, by the way. We thank you for your leadership and most importantly for your faith in us and in this project. This past Thursday marked the end of another exciting session for the General Assembly. In addition to thanking Governor Kemp, I also want to take this opportunity to thank and acknowledge the leadership and dedication of State Senators Max Burns and Lee Anderson. I saw Senator Burns here a few minutes ago. I also would like to thank Representatives Mark Newton, who I did see earlier, Jody Lott, Rob Leverett, and former Representative, now Superior Court Judge Barry Fleming. We're extremely grateful for your service to this community and to our state. And lastly, and probably most importantly, we want to thank our new partner, Wellstar Health System, for truly making all this possible. We're looking forward to seeing how Wellstar's healthcare leadership, experience, and expertise in partnership with Augusta University and the Medical College of Georgia will not only impact the citizens of Columbia and Richmond counties, but will significantly enhance the health and well-being of all Georgians. President Saunders' history may indeed show that the most important decision you ever made as CEO of Wellstar Health System was the partnership with Augusta University. But if that's true, then the second most important decision you will have made was appointing Ralph Turner as the permanent president of Wellstar Health. Well, we congratulate you on being permanent, and we're very excited to be working with you in this new role. Augusta University is Georgia's flagship health sciences and medical research university. We have one priority to this university: our students and our patients. Our new partnership with Wellstar and this incredible facility will provide the Medical College of Georgia, along with our other colleges of dentistry, nursing, and allied health sciences, another unique opportunity to fulfill our mission of training the next generation of healthcare providers and making Georgia a healthier state. Again, thank you all for making this today possible. We can't wait to see what the future holds for our community, for the great state of Georgia. Thank you, and go Jags! It's now my distinct honor to introduce someone who truly needs no introduction, a former Georgia State Senator, two-term governor, and United States Secretary of Agriculture, now currently the Chancellor of the University System of Georgia, and more importantly, my boss, a native son, true statesman, and servant leader of the state and the country, the Honorable Sonny Perdue.
Well, Brooks, well done. As most of us know here, Brooks is in his waning days as president of Augusta University, and we wish you well, Brooks. I think I can fairly safely say we're going to miss you a lot more than you're going to miss us. So, but a tremendous run here with Augusta University and MCG, and the people of Georgia are grateful for your leadership here, and we do truly wish you and your lovely wife a great retirement in the water in the South. So congratulations. Commissioner, thank you so much, and Ralph, thank you both. It's a great day being here. I'm going to start in reverse, I guess, because we're here today, and the Bible says when there's no vision, the people perish. Candace had a good vision. Governor, you accepted that vision and trusted us to put together something that would be good for Georgia, and we're grateful for that. So it's been a great day. You sort of mentioned also, we had a group of people here in the audience today that trusted us last year when we came with a proposal that Teresa and Leo had spent so many hours hammering out, and our regents had approved to create this merger. Our legislators here in the audience today trusted us to provide something good for Georgia, and that had been Governor Kemp's vision all along. So we're very much appreciative of that, and the tenacity and really the courage it took to forge ahead in this area, and we're grateful for that vision, for Wellstar, for the Wellstar MCG Health Team, for Dean Hess and others at our medical college here. It's a great institution here, over 200 years of medical education, and then to have a well-renowned, high operating entity here, combining with the medical education part, it really is, Ralph, the best of both worlds, and you all provide the clinical experiences for our graduating docs, and obviously for the people of Columbia County and the whole state and the region for great health care and well-being. So we're grateful for all those kind of things, and we're especially grateful for Governor, First Lady for showing up today. I think that tells you how important these kind of things are. I told people earlier, I thought we were coming for a groundbreaking, but I believe y'all got ahead of us, Candace, and that's good, because that means we're going to get in earlier and make people more healthy earlier. So that's good news. Obviously, you know how hard the governor's worked to make Georgia the place where people want to come, and they're coming. And he talks about being the best state in the country for business, and that's another third-party acknowledgement, not just something we brag on ourselves, but we're grateful for that. When we looked around, though, the one challenge, Governor, where we weren't in the top was in healthcare and physician, graduating physicians and their opportunities. And I know that you know those numbers. We went over those very much so. Out of Georgia's 159 counties are designated primary healthcare professional shortage areas. 73 counties have no emergency medical physician, and 9 counties in the great state of Georgia have no doctors at all. That can't happen, and that's where Governor Kemp stood up and has continued to stand last year, this year, in a vision for making our healthcare system in Georgia among the greatest in the country as well. And Governor, we're very appreciative of that and your recommendation to the General Assembly in accepting the proposal that Wellstar and our team brought together, our Board of Regents brought together to make this a great day. So we can't stress enough how important it was, the partnership that's been described here today between Columbia County, your patience and persistence in this area, as well as our Medical College of Georgia and Augusta University, Brooks and Russell and Dean and Yvonne, all those who really worked so hard to make all this happen. This was a complicated deal. I think you all get that by now. That's why we're celebrating here, because it is the culmination of a lot of work, whether it's be legal or negotiable types of things that matter and important. We want to get it right, Leo. We're not going to get a chance to do this again, so we want to get it right, and you and Teresa worked diligently in order to get that done. And we want to thank, with the backing of the Wellstar board, the CEO, Candace, and others, and we were successful in getting here today. So we're very grateful for that. Augusta's, as I said, this institution here is almost a 200-year history of medical education. We're proud to celebrate the continued success of Georgia's designated health sciences medical research university and its graduates, many of them whom are working right here in the community to provide great care. And this facility will again enable them to have more opportunity for their clinical practice areas to do that. So I think you can tell from everyone, Ralph wasn't too excited, but I think everybody else is excited to be here, Ralph, and we're so grateful to be here for today for this groundbreaking, to celebrate something greater than we can even imagine today. I'm convinced that this will be a huge turning point, Governor, in the medical provision for Georgia and all of Georgia in health care. And I'm so appreciative that you had the vision to understand what it meant for Georgia. Now I do get the great opportunity to introduce, it's an easy job to introduce somebody you all know. And you know him as a leader, as a visionary, someone who loves Georgia, and someone who wants the very best for Georgia, and that's including health care as well. He's grown this state for economic development, breaking record after record in that way. My good friend and our Governor, Brian Kemp.
Thank y'all very much. Thank you, Chancellor, for all your work and the kind words. It is such an honor for, I tell people this all the time, I really believe it too. We got the greatest First Lady in the country, Marty Kemp, and it's an honor for us to be with you all today. And as the chairman was talking about, this is really a great milestone, not only for Columbia County, but also for the CSRA. And as the Chancellor and President Keel were talking about, for the entire state. I want to just congratulate Candace and thank her as well, and the board at WellStar. We are so excited about this opportunity, and not only what's happening today, but what's going to happen in the future. And Dr. Turner, I'm just going to start calling you Mr. President, if that's all right. If that's all right with you. But I just want to congratulate and thank the entire WellStar team on this great achievement. All the Columbia County leaders that are here, under your leader, Doug Duncan. I know I saw a bunch of the commissioners that are here, the DA, Bobby Christine. Appreciate Mayor Johnson coming over for this, which shows that this is not just a Columbia County project. This is literally a regional, state type partnership. And you know, Chancellor Perdue was talking about some of the things that we've been doing in the state that you get to do when you're the governor, and he certainly knows that. But we get the opportunity to pitch our state all the time and talk about the Georgia way and our partnership approach, in which the state government is working with local government and private sector partners to really grow and move the state forward, and that is certainly the case today. And I will tell you, days like today would not be possible without the support of the local leaders. And I just want to say thank you all for your great support, Doug, you, Scott, the commissioners, and the entire team. I also want to thank Chancellor Perdue for being here and for his leadership and vision in making this project a reality. He mentioned Teresa McCartney, who I know is way in the back of the room, but we all know the work that Teresa put into this project. The Board of Regents, I know there's a lot of the regents that are here today. I spoke to Chairman Reynolds on the phone earlier today. I know he couldn't be with us, but I just want to thank them for their support, not only on this project, but some of the other things that they've been working on in higher education in our state, and specifically Regent Jim Hull. His leadership for a long time in this area is greatly appreciated. And Jim, I just want to thank you for that. I want to thank President Keel, Russell, specifically Dean Hess. I know the Dean was very involved with Teresa, Leo, and the WellStar team and getting this deal done. And Chancellor Perdue talked about this, but I want to make this point again. This was a very complex deal. I mean, there was a lot that had to be done on the political side of things, on the local side of things, on the financial side of things, and on the state government side, from an executive branch side of things. And I just cannot thank everyone enough for really their patience, their tenacity and work ethic to get us through this. But as the Chancellor said, I thought the number one word he said was trust. Just being able to trust each other, trust what we were telling people, trust what they were telling us. And a lot of that trust went to the local legislative delegation. And I know Representative Newton, Senator Max Burns, Senator Lee Anderson, Senator Harold Jones, Representative Rob Leverett, Representative Jody Lott, and our current now Judge Barry Fleming really trusted what we were telling them. And they in turn, we were able to trust them on helping us with the funding that we need on some of the issues to move this project along. And to have their support in the General Assembly was incredible. And as President Keel did, I also want to just congratulate your newest state representative, Gary Richardson. And y'all can tell Barry Fleming that he's doing a lot better job than Barry ever did. Barry will get a kick out of that. But we're excited about having Gary up there. He has fit right in and done a great job. But you know, projects like this, we'll be here next week, obviously with the red carpet tour, selling people from around the country, around the world on the Georgia Way, and our quality of life in our state and our business environment, and us being able to sell that to people. Facilities like this only make that better when we're selling, especially the CSRA. And you think about it, just a little over 5 years, and then during that, as Dr. Cool well remembers, and President Keel, through the COVID times when we worked so closely with the university and the hospital. But in just 5 years, just on state projects that we've working with the local government, we've announced 20,000 new private sector jobs that are coming to our state. Over $14 billion of investment just in state projects alone. Things like the Amazon Fulfillment Center, Arubis, just many other things that have happened in this part of the state that continue to give a great quality of life and give people in our state, hardworking Georgians, economic opportunity. And that level of success is, it really depends on infrastructure and healthcare. And we've taken significant steps, as Chancellor Perdue mentioned, to make this state and healthcare in it affordable for all people, but also accessible. And when I took office, that was not necessarily the case, especially in rural parts of the state. And just since 2019, our Georgia Access waiver that we got and our reinsurance program, which the General Assembly supported in the budget, has helped increase enrollment in private sector insurance on our exchange here in Georgia from 420,000 people to now over 1.2 million. Now, you're never going to hear that in the Atlanta media because they have a different narrative that they are selling. But that is incredible that we have gotten that many people signed up on the exchange with affordable private sector health care. Additionally, over 87% of Georgia counties now have more than 3 or more carriers in that market, when in 2019, no county had more than 2. We are proud of those results, but we also know that we still have a lot more work to do, especially in our rural areas. And for someone, as y'all know, Marty and I are from Athens. I spent a lot of time in my recreational life fishing on Clark Hill, all up and down the lake. And I will tell you that while Columbia County is no longer a rural community like it first was when I was running statewide years ago, there's a lot of areas around this part of the state that are rural, and areas still in the county that are rural. And I've been through those places like Tignal, Rail, Washington, Thompson, Lincolnton. This facility will not just be good for the Augusta area and the CSRA. It is going to be good for a big part of rural Georgia in this state, and that's what's really exciting about this. This region has long been served by the hospital at Augusta University, now WellStar MCG Health, and for decades has produced world-class medical professionals through the Medical College of Georgia, and we're confident that it will remain essential to caring for this region, as well as training the next generation of doctors, nurses, and everything in between that the Chancellor mentioned. This is a critical mission of our university system and of this partnership. And today's groundbreaking is indeed about that future, one where every person in the CSRA will have access to the care they need close by. Once open, this hospital is the Dr. Turner mentioned so gracefully, is going to do a lot of things. And I'm not going to spend a lot of time on it, but when you think about need of acute care, imaging, lab work, inpatient care, also the adjoining medical office building is going to be incredible for this part of the state. And it represents a significant boost to the services offered not just in Columbia County, but again, in this entire region. So I just want to thank you all again for this great partnership and for this trust. And I want to thank the leadership and the whole team at WellStar MCG. I want to thank Columbia County again for their partnership. And I just sit here looking at this facility wondering what this campus will look like in 10 years and what it's going to look like in 20 years. Because this part of the state is going to continue to grow. And I know that this hospital and these partnerships will continue to grow with it. So congratulations and thank you.
Thank you, Governor Kemp, for those fine remarks. So, we still had it being Jennifer? Yep. Thank you everyone for coming out and celebrating this with us. This is a tremendous hurdle for the Columbia County, for the CSRA, and the merger with WellStar will be felt across the state. All Georgians will benefit from this, and I'm sure that somewhere someone will say, well done. Someone will say, well done. So now we're going to turn some ceremonial dirt. I think when you came up, you saw the hard hats right over to my right, your left, and we're going to have some photo ops. Also, I want to point out here, right on the left-hand side, you will see a foundation that's being laid. That's where the medical office building will be. Of course, like Chancellor Perdue said, you can't help but see the steel coming up behind me. That's where the hospital will be. So once we complete the photo ops, I'd like to invite anybody who's interested to come over and sign the beam. Chris, where exactly is the beam at? It's going to be right directly out behind us. Please come out and sign your beam. Put your mark permanently on our new facility that's coming up. So take that opportunity. Then please join us for lunch at the exhibition center. If you go out, make a right, it's right up there on the left-hand side. And lunch is on me. Thank you all for coming. Thank you to all our wonderful speakers. Thank you to our executive leadership. And come on, let's go sign a beam and turn some dirt. Thank you.
There we go. All right, there you have it, folks. They are making their way over to dig up some dirt, sign a beam, and that'll sort of mark the beginning of this groundbreaking for the new Columbia County Hospital coming to the area. It'll be the first freestanding hospital in Columbia County, so that'll be a big thing over there for them. And so the governor was there, AU President Dr. Brooks Keel was there, as well as some others speaking, saying a few words before we got this thing started. So as they make their way over there. We'll go ahead and pull this back up full here in just a second, but we'll have more on this later on in the evening newscast. So it looks like they're about to get ready here. So we'll go ahead and take this back up full, and then we'll wrap things up. And then again, we have our midday newscast coming up at 12 o'clock, top of the hour. So be sure to stay tuned for that, or we'll have more on this in case you missed any of it.
Saying hi. Alright, I'm gonna get out of the way. Alright, if everybody will grab a little dirt. Raise it up and say, well, start Columbia County.
No, you're fine. I don't even.
Alright, going shuttle, so everybody raise their dirt. And so now we would like to add Columbia County officials, chamber, hospital authority, local delegation. Everybody come on back and we're going to push you.
All right, they tossed the dirt. That's the big part that we wanted to see, right? So we'll go ahead and wrap it up here, folks. Again, we'll have more on this coming up throughout the day on our newscast, so be sure to stay tuned for that. And we have the midday newscast coming up at the top of the hour, so you want to check that out on the TV side of things or on the app here on our WRDW streaming app. So we appreciate you tuning in, and we will go ahead and wrap this up, and we will see you on the TV side at noon.